Thank you, Mr. Ronnie, and big congratulations to your successful launch of debates to take the lead of paradigm shift. Good morning, everyone. I'm DS Park from Samsung Process. Today, I would like to share with you how we, as an ICT company, is doing thinking and working on this emerging mHealth field, which is crucial in terms of momentum generation for the growth and resolving the societal challenges. So I'd like to focus on the 5 things to share with you from pure ICT industry perspective. Number 1 is our goal setting. Number 2 is key technology that's we're really focused on. And number 3 is the roadmap that we set up now and future. And number 4 is our key business models. And number 5 is sort of our health platform type of thing, or ecosystem that is really necessary, because this mHealth system is really in need of big collaboration with many multiple stakeholders. So before we start from the very first one, goal setting, I should start from my personal experience. When I worked on my dissertation of magnetic resonance imaging 2.5 decades ago, we haven't thought about this personalized medical stuff. At the time, we were working on a very heavy, bulky MRI imaging system, and it's really difficult to share with doctors and patients about the results or something. But after 1 decade, 2000, early 2000, even before the birth of smartphone, when we first talked about smartphone, we talked about futuristic milestones of personalized mobile health applications type of thing. But now, today, I would say time has come really to implement all these nice things based on demanding voices from multiple stakeholders, including patients, medical doctors, and policymakers, all those social elements, stakeholders group. So for the first things, which is goal setting for us, we as an ICT company, we're trying to certainly deliver increased quality of care and lowering the social cost, specifically focused on the 3 things: better fit, better care, and lower cost, social cost. In terms of cost, we have special interest. If you look at the medical expense in some European countries, for example, in Germany, they are spending 11.3% of GDP as medical expense, which is exceedingly higher than the OECD average, which is about 9%. It's huge social cost. So we, as an ICT company, we're also working, thinking of that perspective as well, to deliver the best cost-efficient high-tech devices and services. And point 2 is about key technology of this mHealth. Unlike other multiple or mobile multimedia devices, this application really does need huge and in-depth and very different technologies for integration. For example, we have identified 4 key technology areas that's really crucially important for medical devices, handheld devices, that include sensors and computations, connectivity, and security. Those are 4 things. In terms of sensors, it's really crucial to guarantee accuracy and integration. How you could integrate all those different sensors, crucial for vital sensing, into that small system on chip type of things. That's crucial. And in terms of computation, with that sensed collected information, how you could have nice analysis to produce or to transform or translate into a very meaningful data set that's really crucially important for other stakeholders. It's also related to big data analysis, but more than that, it's very professional analysis of this computation is needed. And in terms of connectivity, we do need really higher and faster and wider pipe and efficient delivery for this massive information data for medical device. Depending on the situation, depending on the applications, medical device data is totally different from other multimedia data in terms of bandwidth, in terms of resolution, whatever. And in terms of security, this is also we need some very reliable communication, reliable delivery of this important priority data based on more, increased, enhanced encryption, decryption types of things. Those are 4 things that we have in mind as a part of key technical area to focus on. Number 3 is about our roadmap that we set up. We identified 5 steps to go through and to achieve based on evolutionary and/or revolutionary approach. The 5 steps that we identified are like this, starting from awareness, fitness, preventive, chronic, and acute. And the question that we are questioning to ourselves is, then where are we now? Are we in awareness or fitness, or where are we? Many people told us that we're still at sort of Toy Story, as we are still having immature technology because we haven't reached that's real ultimate professional medical services that are really crucial for patients, doctors, and stakeholders. But we certainly have these 5 steps to go through. Seriously thinking about and seriously listening to the voice from the whole consumers. Consumers are a class, patients group. Also carefully listening to medical doctors group and other social infra elements such as insurance and other stakeholders as well. Also thinking about hoping to have some clarification from regulatory domain, but that's a separate story. And in terms of business models, we are thinking 4 types of models at this time. 2 of them are really well known at this time, and the other 2 are really that need sort of futuristic, serious collaboration with stakeholders. The first 2 things are mobile devices with the link with wearable devices. That's well known already. I mean, a lot of people will have this type of things already. And second one is indoor fitness and indoor wellness applications with TV as a home hub. You could have a lot of connectivity with portable and mobile devices. And number 3 is like more futuristic applications, which we want to call BAN, B-A-N, Body Area Network. So with sort of container type of small system as a type of patch type of things, you could actually collect and get a lot of vital signals for your body. And then future use of those collected signals is up to future applications, but we are also thinking about that small but very powerful and crucial things about this as a BAN and its application. Number 4 is interacting with the whole other infrastructures, which is a crucial part of all health systems. With these portable devices, we want to have all connectivity, all-time connectivity with all stakeholders using this infrastructure. Finally, we would like to, number 5 is our health platform system, identifying the 5 key stakeholders and parties or groups that we are seriously, closely working with together. Those 5 groups are consumers group, which include patients and caregivers. And number 2 is industry partners. They're actually good at delivering services. It could be telecom operators and other device and sensor manufacturers. And thirdly, app developers, which is crucial for future graphic user interface for handy operation for all users. 4th one is healthcare professionals, doctors, nurses, and pharmacists. And 5 is payers, which include the government policymakers and insurance companies. All those 5 are the key partners that we are seriously talking with, but we have different level of demand from those 5 groups, which is crucial for us. And coming to the conclusion, I would say we, as an ICT company, we're fully committed to deliver nice gadgets based on nice various voices from many stakeholders, patients, and doctors. also with a nice policy framework from policymakers. Thank you.